my first impressions of BSMS were great. My first time coming here was for my interview, and I fell in love with the city and the medical school straight away. I didn't want to leave. Everybody was really friendly on my interview day, all the other medical students, and it just came across as a really welcoming place, really, and that was just true for all through my years medical school, and especially first year when you're first joining. I moved from North Wales, so quite far away, so it was really nice to instantly make lots of friends and be welcomed down here. My favourite part of the course, probably going into third year, starting in clinical years, because that is what you're kind of working up towards, and it was such a change. It's like having a job but in kind of a good way. And yeah, it was just a really nice change. I felt like it was kind of ready after 2 years of lectures, and you get to see so many cool things in the hospital. So that would be my favourite part of the course. So the early clinical contact starts in first year. Basically, you do a GP placement in first year, and that was great. I loved that from day one, really. That was just getting used to talking to patients, because that's the first barrier, because that can be really awkward at the start, but you get a lot better because you get to do it a lot at this medical school. And when it builds up and then you get to third year and you feel comfortable talking to patients, and then you can start thinking about their diagnosis and symptoms and things like that. So just getting to learn how to talk to patients really easily was, from day one, was a real benefit. So having access to 2 universities was very good in first and second year, because in first year you live on campus usually and have the benefits of both campuses, and especially the libraries, because the libraries can get really full, so you have access to a multitude of different library sites, and you can get involved in numerous societies. I didn't actually join any Sussex or Brighton societies, I stuck with the BSMS ones, but there is, if you have a particular interest in a sport or musical instrument, there are countless things you can get involved with, and just being allowed to explore 2 university campuses is quite cool as well. Living in Brighton is great. I love the city so much. It's really friendly, really open, and like fresh air, living by the sea, and it's just great. It's a city, so it's got all the perks of a city, but it's quite small, so you can kind of walk everywhere or cycle everywhere, and you kind of get to know different areas really nicely, and you, throughout your kind of medical school journey, you live in different areas of Brighton, which I found really cool, because you get to explore different areas. And it's got great shops, it's got great restaurants, it's got great bars. It's a good city. The area of medicine I want to specialise in is actually unknown at the moment. I don't really know. I am very interested in kind of preventative medicine, so through lifestyle and nutrition, but that is not really a speciality yet. It kind of lends itself to GP, so maybe that route. But I'm also really excited for my paediatric rotation this year, which is in April, because we haven't had much of that yet, and I've always been interested in paediatrics, so possibly that route as well, but who knows.